the previous year conclaves have not only helped our faculty members to orient their research and academics towards the need of the industry, but also improved the understanding of our students about the expectations of the market from fresh graduates. Today, we are here to inaugurate the 8th Biotechnology Industry Conclave. The theme of present conclave is redefining innovations in biotechnology in the post-pandemic era. All of us know that the era of pandemic, the biotechnology as a discipline has taken the front stage by contributing to development of diagnostic devices, novel drug candidates, and vaccines. When most of the students, faculties are forced to continue the teaching learning processes via online mode, the biotechnology industry has gone a long way. So it's very important for us to learn from the industry leaders about the progress they have made and their expectations from the academic institutions. I'm sure the deliberations from the industry leaders will support our efforts to make the university a student-friendly institution with a focus on preparing market-ready workforce and employable workforce for the industry. I also hope that all the guests will go back to their places with good memories of Bhubaneswar, KIIT, and Kalinga Institute of Social Sciences. Thank you and namaskar.
Thank you so much, sir. India's bioeconomy has grown 8 times in the last 8 years, from $10 billion to $80 billion. India is not too far from reaching the league of top 10 countries in biotech's global ecosystem. At a time when India is celebrating the Azadi Ka Amrit Mahotsav and setting new goals for the next 25 years, the role of biotech sector is very important in giving new impetus to the country's development. The biotech unicorns, biotech startups, biotech investors, and incubation centers are in sync with the aspirations of New India. KIIT University has as well played a prominent role in these avenues. Ranked as #1 private university of India and 20th among the most influential Indian universities, KIIT is brought to such recognition under the leadership of Professor Saranjit Singh, the Pro-Vice Chancellor of KIIT. So let's have a big round of applause for him and invite him to address the gathering.
Thank you so much, and very warm good morning to everyone in this August auditorium. And first of all, at an outset, let me be a little sorry because we were tied up with some activities. We have an academic council meeting going on, and our convocation is scheduled on 1st. So there is a lot of pending agendas to be cleared before we disburse degrees to our students who have already graduated in 2022 or who are supposed to get degrees, even in PhDs. So a lot of approving things are happening because of that, and we were caught up there. I'm extremely sorry for all the guests on the dais as well as the dais. Well, very respected guest of honor, Dr. Jayashree Pramod, Regulatory Scientific Lead, Novartis India. Very respectable chief guest of the today's program, Mr. Priti Singh Bhatia, Associate Director, HR, Jubilant Biosys. Our dear colleague and Dean Professor from School of Biotechnology, Dr. Srinivas Patnaik, our team from industry engagements, which I is still heading as a director, Dr. Professor Gopal Chaudhary, all these team panel members who have come across India from various corporate R&D organizations and institutions, our own faculty members, staffs, and young boys and girls who are sitting here. As what I heard probably from your dean, that this is the 8th of the season. So I have been part of a couple of the seasons of biotech industry conclave. And for those students who might not be keeping tab of people at the helm of affairs in your own university, probably this is for your information that I have been director for industry engagements and training and placements of the university for the last 11 years and have been the former dean for School of Mechanical Engineering as well in 2009 to 2011. And in that capacity of heading industry engagements, training and placements, probably we have an extended team where we work very deeply with all the federated schools of KIIT University, which also include schools of biotechnology. So I thought that because most of you might be in first year, might have joined for, I've come for the first time, and many of you who are in the second year and third year, and the PG students probably, you might have come to KIIT after the pandemic and you are all away physically from the campus. You must be keeping tab of people here and must be keeping tab of the activities happening here. Well, if you look at the theme of the conclave, I mean, it has become like a usual practice now, because once you are over with the pandemic or endemic, so probably we have been trying to focus more on post-pandemic era and the effect of probably last 2 years, whatever this entire mankind has seen on all the activities which we do. This is my 5th conclave starting from July. We are having tomorrow a mega HR conclave in School of Management, where I'm directly involved with the panel discussions and keynote lectures. I tell you, most of the time, we are trying to bring in last 2 years of experience in understanding how the things will unfold in coming years. But if you see biotechnology, of course, the pandemic might be affecting the area or the field of biotechnology at the most, but I think last 20 years, at least last 2 decades, what I have seen so closely is already been the decades of biotechnology. And the reason I'll cite for most of the young guys who are sitting here, that in mid-90s, I was at IT BHU doing my master's and PhD in mechanical after a small stint in industry. And just dead opposite the mechanical school, we had a biomedical instrumentation building. And for me, that was like something very, very novice and first time kind of stuff. I made some good friends, and when I went inside, probably I saw how they were actually operating on, and they've been carrying a lot of experiments. And it enticed me and excited me. And when I landed to my first teaching job, probably the building again adjacent to my building was School of Biotechnology, and I had a lot of good friends. And I have seen this field, at least not as a part of this field from the research point of view or from the teaching point of view, but at least how the field has evolved and grown. My previous organization had a full-fledged center, instrumentation center, only to take care of biotechnology research. And I'm very, very happy that you are in a school which has been mentored by one of the, you can say, visionary academic leaders like Professor Mrityunjay Suar. I was asking about him, and he is traveling. And he has been very, very particular to instill the R&D culture here in the school. I have a lot of fights with him where we have been discussing how to trade off between what he used to think that, I mean, the courses has to be more on R&D side, or the courses has to be more on the skill side, so that the students find ready employment. They are day one industry ready. This is a classical fight which happens. Even being a professor, we used to have those discussions. But I'm sure there is always a golden point in between these two trade-offs. And school definitely will poise the basic tool, which is a learning tool, that is a syllabus and the structure, even as per the guiding norms of AICTE UGCs of the world, depending upon the chunk of students who will be actually going for higher studies, the chunk of students who will be actually going for the career in corporate. And that confluence and mix has to be taken care, because I tell you, we are a very, very student-friendly industry. There are a lot of students from biotechnology, I don't remember the name. Start of this semester, they were continuously giving me call because they were interested in participating in some of those IT services or IT product companies where the applications of biotechnology is. So if I take Industry 4.0, if I take AI ML, if I take data sciences into picture, it means that all these applications and these all are been heavily applied. I'm not talking about bioinformatics per se, but as such, Industry 4.0 tools are heavily employed in biotechnology area. So my only request to all the young minds here is that today biotechnology is not going to be a school in silo. Any technology is not going to be in silo. It has to be confluence of activities. It has to be convergence of technologies. So while you are staying here, take the full advantage of KIIT, because you are in a university which has got more than 200 programs here. You have law sitting just next to it. And probably many of you might be interested to know the legal systems with respect to biotechnology also, or biotechnology, ecosystem. You might be interested to know what's happening in electronics. I tell you, School of Electronics Engineering, School of Computer Science Engineering, and School of Mechanical Engineering have come together to sign an MOU with Intel, where some people from the Intel, like Dr. Satya Gupta and so on, who are the founder member of VLSI, Society of India, Semiconductor Society of India, they have come forward, and we are going to establish a high-end R&D lab in biomedical instrumentation, or rather in medical instrumentation or medical electronics, what we call, within our KIMS, which is our School of Medical Sciences. Now, you might think how Intel is coming here, which is the world's #1 semiconductor manufacturer, design and manufacturer. They are not only the manufacturing, because there are other big giants who only manufacture, like Foxconn and so on and so on. Probably they are all in news. And probably if you keep the tap of things happening in the corporate world, you might know that Government of India, just a couple of days back, has announced that there is going to be a large impetus as far as semiconductor industries are concerned. So I'll not talk more on semiconductor. I'll not talk what Vedanta has been saying, probably where the plant will come in with 1.25 lakhs of crores of investment happening. But with the development of technology, whether it is in the area of microelectronics, whether it is the area of VLSIs, whether it is the area of industrial IoT, whether it is in the area of distributed cloud systems or big data, every field will get impacted. And biotechnology is also which is going to get impacted or utilize most of these tools. So when you study here, keep your eyes and ears open. Don't live in day-tight compartments. I mean, there are a lot of cross-functional electives which can be taken here. Take the advantage of that, number one. Number two, there are a lot of cross-functional initiatives happening in the university. If you want to go and see the design thinking lab at School of Electronics, where Bosch is doing something, and it could be in the area of medical electronics, go and see what's happening there. And if you want to be a part of the project, you can be. So take the full advantage, number two. Number three, these kind of events are very regular. Probably you must listen to the people who are here, because they are all been the experts in their field and has been one of those known faces. And I'm sure with their, you call it tech talks or pep talks, I mean, in your life, you need just one turning moment to change your entire focus and attitude. If that is one moment is here, maybe in a couple of days, probably your career will fly from here. So I'll not take much time. I'll not stand between you and some of the esteemed speakers who have come here, and we are all going to listen. I wish you all the best. I wish the entire office bearers of this biotech industry conclave all the best for the next 2 days. And I wish the outcomes of this biotechnology industry conclave must be recorded. The performances of last biotech conclaves must be seen that how probably we have been progressing as far as our targets are concerned. With this, again, I warmly welcome both the guest of honor and the chief guest, Mr. Priti Singh Bhatia ji and Dr. Jayashree Pramod ji amongst us, and we look forward to listening to you. And again, I'm very sorry for delaying the program, as well as sorry for my bad throat, because I have been running with fever and cough and cold from last 3 days. But anyways, it was a pleasure meeting all of you. Thank you all.
Thank you so much, sir. The present decade has seen the trust and reputation for biotech sector of India, for bioprofessionals of India. Today, if India is being considered as a land of opportunities in the field of biotech, there are many reasons for it. The diverse population, diverse climatic zones, India's talented human capital pool, ease of doing business in India, increasing demand for bioproducts in India, and the track record of successes of India's biosector are among a few. Novartis is one of the leading biotech ventures of Switzerland that brings medical innovations to life. With their base in India, Novartis works to discover and develop breakthrough treatments for improved healthcare facilities. Ladies and gentlemen, today we have among us Dr. Jayashree Pramod, the scientific lead at Novartis. Please put your hands together to welcome Dr. Pramod to deliver her address.
Thank you very much for the warm welcome, and thank you very much for the sweet words, Dr. Bhavna. I'm here today, and I'm super excited. I'm extremely inspired to see a battery of students, young ladies and gentlemen here, who are going to embrace this field of which I'm extremely passionate about. And believe me, when people in my age group, when we started in this area, there was hardly any mentoring. There was no, not much of career pipeline, not many opportunities in this field. And today, it would be a very soft word, if I could choose a word, like a boom. Okay, so boom is something which would be undermining currently what is happening in the field of biotechnology. So when actually the first monoclonal antibodies as therapeutic options were announced in around 2004, we were all looking at our immunology books, and it was like a dream come true for most of us who studied mammalian cell lines and things like that. And then around 2010, we were of the opinion that everything is settled. We've done almost everything that was possible. And then companies after companies in this field started announcing breakthrough technologies like RNA silencing, gene editing, cell and gene therapy, and many more to come. And let me just ask you a very rhetorical question. How many technology fields do you find a PhD in physics leading the lab of maybe electrical engineers? I'm sure I don't think I can think of one in this many years. If you can give me, I'd be really surprised. But biotechnology is a field which is extremely science-driven. It's a very, very vast field where the driver's seat, the person in the driver's seat is the scientist, but who is following is all those people who dare to think of applications. So in my opinion, a conference like this, an industry conference like this, actually opens out the vast arena of opportunities available to students like you. And we never got an opportunity like this. So I must commend that a great attempt has been made here to make sure the students of KIIT get very good exposure and are aware of what's happening in the world outside. Because the textbook that we read from, it talks about science, but it misses out the passenger there. So when you talk about bioprocessing, what you're learning is a theoretical platform technology, but what's happening outside is way ahead of all of these things. So make use of this opportunity that your faculty and your institute is providing, and make use of all the cross-functional skill set that you can take from here and make it as big as you can dare to dream. Because dreams do not fail, people fail. So you can dare to dream as big as you want. You can dream to be heading the largest pharma group as an Indian from India. Okay, I'm saying as an Indian from India because we've seen Indian heads, but none of them belong. They've not studied in this education system. They have not made it big from this education system. So today we are seeing people like people in the IT sector. Like a lot of people we see are from colleges in India who've studied here and predominantly lived in India, and then go out of India and make it big. So in my opinion, there is nothing wrong with the scientists in India. There is nothing wrong with the education that we are getting. It's simply that we are not ambitious enough to, or we don't dare to dream those big dreams. So I would strongly suggest just have a very big dream, light up the fire in your belly, and then go for it. And there are people like us here today and tomorrow who are there to support and nurture these dreams. So reach out to as many people and grab the best of the opportunity that you get, and then go for it. Because there is nothing that is not possible for you. You are at an age juncture where you can virtually accomplish anything and everything. Okay, so I'd just like to finish with one small note of something that you can carry back with yourself. So in 2008, we were all super excited because India was recommended to be the country with the youngest youth population, the highest amount of youth. It was considered to be the youngest in terms of workforce. And nothing majorly happened, nothing major different happened for India. So when one goes back to see what was missing, the fact that we are missing out on skilled labor is the reason why this did not really materialize for India. So today, we have less than 2% of our population, which is having skilled forces. So that means that people above secondary education line. And this has got nothing to do with the system, the infrastructure, or anything. It's just that people and their ambitions get diluted by the day-to-day life. Okay, so just make sure that you become a part of that 2% and above, which is going to take India into the next decade of biotechnology, and make it big, because you will fly as high as this technology flies. So I don't have much to say today. I hope tomorrow I will share with you a part of my curiosity, my inspiration, and my passion for this area and domain. And stay with me in that session, and hopefully I can sow some seeds of curiosity in you, and then let's see where that takes you from there. Thank you very much for your patient listening.
Thank you so much, ma'am. The number of steps India is taking today for the development of biotech sector is unprecedented. In the last 8 years, more than 5,000 startups are associated with biotech, showcasing that a sizable talent of the country is rapidly moving towards the biotech sector. The number of people investing in our biotech startups has grown by 9 times since the launch of Startup India. In 2014, there were 6 bio-incubators in our country, and today it has increased to 75. We had only 10 biotech products our country till 8 years ago, and today this number has grown over 700. The biotechnology sector is also benefiting from the unprecedented investments in India, making its physical and digital infrastructure. These steps and successes are only possible when companies like Jubilant Biosys lead in infrastructure and knowledge wealth generation. As a leading preclinical contract research organization, Jubilant Biosys has been supporting and promoting scientific discoveries in India. So let's welcome Mr. Pritesh Bhatia, Associate Director, HR, Jubilant Biases, to say a few words.
First things that comes from my mouth is, wow, so many people I have not seen in last 3-4 years, right? So thank you so much for coming in these numbers, right? So first of all, a very warm welcome to each one of you. It's absolutely my pleasure and honor to be part of this conclave. I have been coming to KIIT University for last more than 5 years. In the morning, I was joking with Mr. Gopal that I do deserve a gratuity because I have been coming here in tonight. So funnily, in the morning when I was coming, I was guiding the driver, please take left, please take right. This is where we have to go, right? So with that, I don't have much to speak, but I'm really happy and excited to be here. And I'm really looking forward for the great sessions and a great learning, right? And I wish you all the very best. Please enjoy, have a great day. And there are amazing level of speakers. I got an opportunity to interact with a couple of leaders last evening. So I have no doubt that there will be a great learning session for you guys. Please ask questions. There's nothing known as bad question. There's nothing known as good question. Whatever question comes to mind, please feel free to ask because you have so many industry speakers coming only for you guys to present their perspective. So please feel to ask us as much as you can ask. Okay. As a part of a talent acquisition, I can tell you, leading an organization, I've been coming, as I said, I've been coming here for 6 years and I've got some fantastic talent from your university. And I'm sure you guys will keep that flag high, right? So after this meeting, I have a discussion with your dean wherein we can put the all synergies together. Where should I get more and more talent? Is it? Yeah. So thank you so much, and have a great day. Keep the Josh high. Okay, thank you.
Great. Thank you so much, sir. May I now request Professor Saranjeet Sarangi, Pro VC, KIIT University, to felicitate our guests of honor today. Sir. We have seen throughout the period of COVID how there can be unexpected results in a short span of time when research, academia, industry, and the government worked in tandem. From essential medical devices, medical infra to vaccine research, manufacturing, vaccinations, India did what no one could have imagined. This synergy between government, industry, and academia, from biotech to all other sectors, have brought India out of the major crisis. And today, I'm happy to see that there is presence of almost every sector related to biotech industry in this hall. We also have a large number of biotech professionals associated with us online. You will be discussing the opportunities and challenges before the biotech sector in this conclave in the next 2 days. And it is to the credit of Dr. Gopal Chaudhary and his team of very efficient colleagues that we could bring this biotech industry conclave together. So let's welcome Dr. Chaudhary to say a few words and extend a vote of thanks to the participants.
Thank you, Dr. Bhavna. A very good morning, distinguished guest on the dais, Mr. Pritesh Bhatia, Dr. Jayashree Pramod, Professor Saranjit Singh, my colleague, Dr. Srinivas Patnaik. Off the dais, esteemed delegates, faculty members, supporting staff members of the KIIT, dear students, ladies and gentlemen. A very good morning to one and all. At School of Biotechnology, we believe that academia and industry are the two propellers of the same boat. And hence we always take initiatives to sail together. And as rightly mentioned by the previous speakers, this 8th edition of Biotechnology Industry Conclave is one such humble initiative in that direction. It is really a humongous task to bring 30+ industry stalwarts under one roof, and it requires efforts and support from people from various dimensions. At the outset, I thank all the esteemed delegates from the various industries who took out time from their busy schedule and to be here to interact with our students. I'm sure they will go back with a smiling face and a positive notion. Thank you, sirs, and thank you, madam. I must thank the KIIT University leadership, Professor Achyuta Samanta, founder KIIT and KIS Universities, Professor Shasmita Samanta, Vice Chancellor KIIT University, for creating state-of-the-art facilities, which makes it possible to organize events of this mega size. Heartiest thanks to Saranjit sir for being here and inspiring with your kind words. Thank you, sir. A big thank goes to faculty fraternity, student volunteers, supporting staff members of KIIT, and a special thanks to Dr. Srinivas Patnaik, Dean School of Biotechnology, for his able leadership and guidance. Thank you all. And lastly, dear students, thank you all for being here. And I hope these 2 days will be full with vibrant discussions and deliberations and a lot of take-home messages. Thank you.
The biotech sector is one of the most demand-driven sectors. With the ease of living in India, the demand of healthcare sector is increasing a lot. We are expanding through telemedicine, digital health ID, drone technology, biofertilizers, organic fertilizers, biofortified seeds, biofuel, 10% blending of ethanol in petrol, and many more such efforts will create new employment opportunities for biotech professionals. There's going to be a huge consumer base in the country for biotech in the near future. So let's gear up, hear carefully from all the speakers, prepare a list of actionable points, and work towards your goals. We all have great potential, so let's march with strong head and compassionate head. Thank you all, and I wish you a great experience. Before we leave this hall, let's stand up for the national anthem. Thank you all. Let's take a short tea break and meet again for the next session of this morning. at within 15 minutes, please.
चल ठीक है, इनॉग्रेशन में कैमरा की जरूरत है।
ଆସିବ ଲାଇନ କେମିତି ହବ ଅନଲାଇନ ଯେତେବେଳେ ସେ କହିବେ ତା ଲାଗିଥାଉ ଲଗେଇଦବା ତ ଲଗେଇ ଦେଇଛି ତାଙ୍କର ଯଦି ୟୁଜ କର ନ କରିଲେ ଆମର ଟେନସନ ମାଇକ୍ ଆମେ ହ୍ୟାଣ୍ଡ ମାଇକ୍ ଦେଇଦେବୁ ହ୍ୟାଣ୍ଡ ମାଇକ୍ ଦେଇଦେବୁ ବଟ ଆଉ ଅଡିଓଟା ଆସିବନି ଆଉ लाइट आ जाएगा साइड में लाइट आ जाएगा
Welcome back, all of you. I again request all of you to kindly switch off your mobile phones or put them on a silent mode. Leave the KIIT Wi-Fi network, and please do not get up during the talk. So let's begin with our very first session, technical session of this morning, reconstructing policies and SOPs to ensure efficient workforce in the new normal. May I request on the dais, Ms. Varsha Alok Ranjan, Regional HR Manager, APAC Premier Research, Ms. Sujaita Ghosh, Talent Coach, New Taste Food and Drink Labs Private Limited, Mr. Rupankar Chakrabarti, Head HR Rain Industries Limited, Mr. Pritesh Singh Bhatia, Associate Director, HR Jubilant BIC Limited. I request all of you to kindly take your seat. This is an HR session. We will hear from the guests for some time, and we look forward to your questions, to your queries, so that we can have a real one-to-one discussion. I will request all of you to come up with questions that have always been bothering you, be it anything. You have the opportunity right now. Please ask good questions so that you learn from here, and then you can prepare yourself accordingly. Let's begin with Ms. Varsha Alok Ranjan, Regional HR Manager, APAC Research. She is a Regional HR Manager at the Premier Research and has previously worked as HR Services at KIIT and as a consultant at Recently, I saw a huge article, or actually an advertisement on Times of India, the very first page of Times of India, and it was written Capgemini. I really have no idea what Capgemini is, and now we have a very pronounced personality of Capgemini. She has done her master's in business administration from Senior Institute of Management and has a degree in strategy human resource management from IIM. She has been serving employees throughout the HR life cycle, coaching employees and line managers to speak with their matters, advising employees and managers in career planning and development, driving annual performance management cycles for standard and entity-specific awards and recognition program administration. This virtual works closely with different stakeholders to align the HR agenda with business agenda, influencing compensation, benefit strategy and policy through compensation, discretion, and innovation. She is responsible for implementing performance improvement process for the aligned entities and is accountable for effective delivery of HR programs, services to the group. Varsha, I'm sorry to say I understand nothing at all. And I'm sure our students have not understood also. This is beyond that. So that is what we have to enlighten and help us to understand. So, all of you. A very good question, but still I would want to make sure that everyone can hear us loud and clear. First and foremost, thank you so much for having us here, having me here, giving me this opportunity to come and speak to you all. I know, I'm here for 3 years and I'm probably going to complete with Hitesh, completing 5 years, and we both grow gradually. So, and I will talk about gratuity as well. I'm not sure if maybe say what is gratuity. Gratuity, yeah, you guys, touch each other and say, hey, gratuity, what gratuity? Or maybe Google about anything, okay? But really, this is a huge opportunity where the professors, everybody can have thought to really well, work hard to bring all of us together. It's a huge opportunity. And I remember being on the other side, probably 11 years back, when I was doing my MBA, and I never got a chance to interact in this kind of a forum, bringing so many profound leaders together and getting them to interact with us. It's a huge achievement for KIIT. And give a huge round of applause to each one of them. Thank you, and yes, we will interact throughout the session. Thank you. And I can tell you, just really great what you said. So many of you, yes, so many. So much for it. I'm sure you must have lots of there regarding category or investments or salary or other recruitment processes happen. So let's hear from Mr. Ruparkar Chakrabarti, Head HR, Rail Industries Limited. He heads the Human Resource Department of Rail Industries with the responsibility for HR related matters of its subsidiaries and corporate level, internal audit, and shared services related matters. He has more than 22 years of experience in HR, predominantly in healthcare today. Mr. Chakrabarti has been working as Head Human Resources for Reliance Life Sciences and Integrated Enterprise for Reliance Group for the last 40 years. For a short stint, he has badge at Pharma Enterprise, served as a Group HR Healthcare Conglomerate, New World Group in Chennai. Mr. Chakrabarti has also worked in companies like KIIT Corporation Limited, a financial institution and global shipping giants like BIC, Siemens. Mr. Chakrabarti holds master's degree in human resources and management from IIT Kharagpur and in biochemistry from
Thank you, Varna. So thank you so much for the introduction and so much for inviting me, and I'm very happy and privileged to share the dais with people like Dr. Sujata and Varsha. And first and foremost, thank you, KIIT. It's the first time I'm coming to KIIT, and I totally got overwhelmed. Yesterday evening, I came, once I have a number of times, but I never had knowledge. KIIT, though I have interacted with students, I've taken students, whether it's in plant licensing, students in our GT programs, number of students, and their performance is very good. So fantastic, the way the infrastructure has been built and the way this is being managed, such a large scale, I really got overwhelmed and really got like what the teacher was saying, wow factor. So I've seen number of institutes in India, number of institutes outside India, but this is phenomenal. So I was telling Hitesh what you talk about SOP. I think we should learn from them how they manage such a big institution, such a big setup. They must be having fantastic SOPs in place, and they must be doing, they must be managing those SOPs day in, day out, making sure without any kind of mistake, any single percentage of mistake. So we are given the responsibility to talk about the SOP and share the workforce in the So yeah, of course, the normal has been changed during post-pandemic, and we'd like to hear from you what is your opinion about the new normal. But all of us have faced in the corporate whatsoever that has been changed. And organization what I serve most of my time, Reliance, never had a kind of concept of work from home. So overnight we had to create a structure, infrastructure for work from home for 70-80% of what people apart from people who are in the essential services like life sciences or field and networking, geo or retail, those who are doing the essential services. But it was a huge task for HR and then creating an infrastructure and ecosystem for engaging people, how to keep them engaged, whether they will work during the work from home setup, what kind of productivity metrics we have, what kind of follow-up we have, what kind of review we have. That is one aspect on the both side. How we take care of their health, how we take care of their well-being, how we take care of their near and dear ones here. So, unfortunately, someone got sick, what kind of precautions, what kind of measures we have, so kind of quarantine center, hospital, it was a kind of a crazy period. I'm sure crazy period for all of us, especially in HR, who are dealing with the people day in, day out, day in, day hotline, call center, help desk, doing so many other things. So it's a huge experience, and that experience gave us a new opportunity, experience to learn. So all of us learned from there, and the people say like, crisis gives you an opportunity to learn. That was a classic example of how we learned. How we learned in the context of healthcare. So we are little behind in technology and little away from information services. Where I was telling someone, but that was an eye opener for us. The pharmaceutical industry or the healthcare setup also understood the importance of information technology, understood the importance of other set of technology which actually help in creating a better workplace, creating a better workforce. So I deal with that. I listen from others also, and probably we have more interactions. And I request all of you to ask us questions. More you ask us questions, we will be able to share our experiences, share our views, and then we have a kind of discussion. And of course, what we promise is we won't allow to see that's another way to keep you awake. So I give the forum to other panelists also, and understand from them, and then probably we can have a better interaction with involvement of all of you.
So let's move on to our guest of honor today, Mr. Ritesh. He's a talent acquisition manager, big firm, and an associate director at Jubilant Rices. He previously worked with GlaxoSmithKline talent acquisition manager, and in this role he was responsible for developing a comprehensive recruitment strategy focusing on diversity sourcing, attraction, selection, and candidate assessment. He worked closely with functional and line leaders to provide them with relevant information on current job. He promoted greater TA accountability via assessment and publication of metrics about candidate food quality, reduction in time to fill, and improving the candidate internal customer experience with complete system knowledge. Mr. Ritesh, previous role has also worked for Max Life Insurance and Better. He has an MBA degree in HR and marketing and a bachelor's in commerce.
Thank you once again for the lovely introduction. It's good to hear and good about you. So very nice. Thank you so much. So guys, when you talk about SOPs, somehow SOP over predominantly is based with HR, right? And I came to understand why it is only HR responsibility in an organization to build SOPs. So when I'm joining the organization just now, 10 years, and the previous organization also. So when you talk about SOPs we make for employees. All the SOPs which you work, it has absolutely has and build safety with the quality and the people you work with, right? So it's very important that you work on the SOPs which is absolutely employee driven, which are benefiting employees, right? And it is not that HR is sitting in the side and making these SOPs. You have to involve business people, you have to involve different genre, different department of people so that we are in one synergy or we are in one page, right? In terms of making an SOP. So when I talk about what happened last 2 years, I think last 2 years was really crazy, right? We never knew something like this would come up. I can tell you from my personal experience when I was in GST, we were supposed to have 100 people joining us, and all of us have been working on this lockdown. And we were clueless that what needs to be done. How should I make these 100 people join and these 100 people would like to learn them, right? We never had a concept of sending an iPad. We had a concept of people come to the training. It's a face-to-face thing. We will give an iPad, and that's how they will start working. We will do this over the night, how when human kind is pushed, and how you can transform yourself to modify, to mold yourself in the current scenario. That is what I personally done in the last 2 years. It's a great learning experience for me from a talent acquisition point of view as it's for me part of the HR. Because how we transform, as simple as working in GSK, they had a culture so that I didn't see a person, I'm not supposed to clear that person. Moving from there to interviewing someone on Teams, we never had a concept of doing that. That thought process needs to be changed. Forget about interviewing a person. Interviewing thought process needs to change. So we design a structured training for our trainers. This is how you are supposed to do it. Right? So there are many such examples I would like to share with you guys. Hopefully, I can see the questions. I'm more than happy to answer them. But I would request, please feel free to ask as many questions you want to ask. We have some great panel members there, and they will be able to answer all the questions. So thank you, and thank you so much. And thank you so much, again, for having me here.
As you said, that we are getting out of crisis response and recovery. So it's a huge responsibility on HR to bring people back in their form that we used to have.
Right.
And it is so difficult because the definition of workplace has changed. Even the workforce has changed. So bringing them back to their previous form is a challenge. And I'm sure you must be working very, very hard. And our students also have been in their comfort zone in the last 2 years. They must have gotten the touch of all the instruments coming from here. So it's difficult for them and also for us. So that is what we are here to learn, and I'm sure they will ask you more questions about what you look for and what they should work on. So let's move to our next speaker is Sujoita Ghosh, and she's currently a talent coach for Newchase Group, known for her remarkable objectivity and exceptional grasp of human dynamics critical for an HR person. She studied psychology from Delhi University and completed her PG diploma course from CS Business School, Chennai. She served as an associate vice president HR North at SREI before joining as general manager HR at DSS Engineering, and was involved in re-engineering existing processes to the next level and bringing in organizational change. She believes in leading by example, with her expertise lies in talent acquisition, management of client engagement, process re-engineering, and HR automation. Ma'am, a few words. Okay. Good morning to all of you, and thank you, Dr. Bhavana. Great to be here. My first time in this university, though I have hired from her and met a lot of her students back in Delhi, where I am from. So I'm quite interested and excited to be here because I see kids, and I say kids, a lot of you guys have been referred to as ladies and gentlemen, so I continue to call you kids because I think most of you are younger than my older child. So I know how the last 2 years you have been lying in bed with your guards on and not putting on a video for those poor professors who were trying to educate. So tell me if I'm wrong there. I think there'll be 1% who can tell me, no, ma'am, I attended class properly with the wrong. So I know what you guys went through, and I think the whole world went through. So I have a very interesting, so I did science only to class 12. So after that, I'm an out and out humanities, social science student. With that in mind, I would like to tell you a little about my career path, which has been quite checkered, quite unlike the standard corporate kind of thing. So I consider myself an SME specialist because I have worked with small and medium enterprises only, other than my first job, which was a large company. Being in multiple industries, from petrochemicals to biotech to medical devices to engineering design to financial services, banking, and now food. So I think the entire breadth of the industries that I've been in, there's one common factor that people define it all. And I have a theory which is my only science that I maybe learned in school, the Darwin's theory of evolution. I think all of you are well aware of that. So it says that we became human beings from monkeys only because we stopped losing some faculties, right? Our tail dropped. So the pandemic, which was a crisis situation, brought us to a point where we needed to use every faculty we had in place to ensure we survive. A lot of us have gone through crazy times at work and personally. A lot of us have had losses, and those losses will never be, forgiven, fulfilled, no completion, no end there. Closures won't happen. Maybe for a lot of us, forever the closure will never happen. My take as an HR professional in the last 2 years has only been care. And when I say care, it is not only from the employee was primarily important, but also from the organizational perspective. So while both sides have to be balanced, the fairness of care is what we focus on. And I personally focus on. So I really look forward to a lot of conversations which will be of interest. Want you guys to really come up and question, and backbenchers, y'all are our focus. So y'all are the ones who are going to come first and question us. So please feel free to question. We are happy to talk to you.
Thank you so much. Actually, I believe now pandemic has shown us that we have to put both head and heart in the business now. We have to be strong-headed and also compassionate. And these 2 last years have taught us a lot. So how do you think that the companies are taking care of this head and heart part of doing business and having students or talented recruited and continuing them with them so that they are focused both with their head and heart?
So let me try to answer this. Not that earlier there were no head or heart in an organization. So as an HR professional, I can never say that you only work with head, never have heart in your work. But as you said, COVID has created opened a new kind of phenomena, it's a paradigm shift. So a lot of people, I can tell you from my experience, Pritesh is a talent acquisition expert, also probably. When I'm taking the youngsters and I'm sharing on GE program, the compensation structure, the first question used to be asked, sir, also, yes, sir, choro, or insurance choro, how much money will you take in hand? That was the typical answer. How many of you agree to that? You are more focused on how much money you get in hand. Okay. So today, not many, right? 20% of these things. Today, a lot of focus and a lot of questions are being asked when the same compensation structure is being thrown to a GT or a youngster. Sir, insurance, medical insurance का क्या है? How much is the medical insurance and are my getting that? That's a typical question I've been asked for last 1 year. I'm sure all of us on the forum would agree to that. And most recent example, I think when I moved to my new organization, the current organization where I'm currently, the first thing which I was told, so whatever you do, not to do, but please put our name in the medical insurance. So that's the kind of art is being asked for to be put by an organization by his or her employees, and then that's the kind of art an organization is trying to, and we are putting our best effort to take care of our people in terms of whether it's medical insurance or different other wellness programs, mental wellness programs. So there's a lot of focus. So that's why when you talk about the efficient workforce and the general way that we used to deal with people they have changed, and the kind of paradigm shift has happened in the context of taking care of people's mental health, their stress level, or their fatigue, what they have gone through during the last 2 years. So that's a new addition to the art of an organization which is being put into, and organizations are doing their level best to do that, and I'm sure the organization which we represent or which represented during the COVID time, they have gone extra mile. They have went extra mile to take care of its people. I can talk at length about what kind of measures we have taken during the COVID, and then that's going to continue. That would be another new normal, and that's one aspect that HR has been HR is taking very seriously, and that would be another new normal for all of us.
Yeah, and just to add, starting from the COVID meetings, which was held over there, so we were definitely asked, like, if somebody we get COVID or my family members get COVID and we have to take care of them, what do we do? Do we use a vaccine? We use a casualty, we use a paid leave. What do we do about it? So there was a different kind of category which we never thought, right, that we would have in our organization that's called COVID leave itself, or somewhere it's called differently, I'm not too sure, but that was introduced, and people were well taken care of, and when people start to join the organization, they used to ask for it. Do you have a separate set of leads which would take care of this? So, and specifically to my organization, we have a cultural anchor that is called empathy. And getting back to what just now we were mentioning about care, empathy, that has become definitely the key for the organization to operate. That's a new one.
Okay, from HR company, I tell you, the biggest asset of an organization is not a commercial value, it's the people, right? If your people are safe, if your people are happy, organization is vital for people, right? So you have to put in mind, this is not our, this is my organization. Till the time you have that, this is my organization, no employee can put the other person, right? So coming from an organization that is like 100 years old in India, right? Where employees are kept here, all SOPs and all processes are keep in mind, considering them, you always have to work around them, right? You cannot work in silos. Last 2 years was absolutely a paradigm shift, right? We did numbers of initiatives, right? We had a third party, now in Optum. We always had an Optum, third party, because we feel that there should be someone who can talk to. The usage of that the last 10 years was so 2%, and then electric triggers in the last 2 years, from 2% went to 45%, right? So it was a paradigm shift, and we were all told that's what needs to be done. But yes, great organizations. For me, the biggest challenge was one day we were told it's a lockdown. There were 7,000 people sitting at home. I had no idea. The organization had no idea what needs to be done with the 7,000 people. It's not that we can just put them. We're a commercial viable organization, right? We have to grow. We have aspirations to grow, right? But then not keeping our employees at the mercy of them, right? We have to structure ourselves in a manner where we are achieving target, but we are we're taking our first priority as well. I think again, proper opened also. And it's opening phase by phase, not when you put we had 700 employees. Let me tell you, it was an extremely difficult decision because so many employees go out because farm industries are out. It's very simple. If you don't visit the doctor, your prescriptions will go down, your promotion value goes down, right? So when we send the first 100 people, then now I said that of those 100 people, 21 people were infected within a week. So how do you motivate your people? So nobody had an answer. But then hats off to the commercial team, our leaders who stood by the floor and got it and decided to support in that critical time. All you support employees is something which is a thing which an employee will always remember. An employee will always remember how you treated them at the first time, and that is what when we talk about heart and mind, not just the picture. That's it.
It's a very symbiotic ecosystem.
Yeah,
and we actually need to have a very sense of belongingness, both the employee and employer, and then only we can move forward. And it's very, very
you have to be extremely empathetic. Yeah, you understand, you can just pick up a phone and tell, why this doesn't happen. Maybe because it's not the employee mistake, because doctors not doing it. Because I remember when we opened the company market, in average call average was supposed to be 17. They were not able to achieve more than 5 because doctors themselves were not able. To change the mindset of doctors was another challenge for us because they never thought that something was a digital market. Right? So transforming an organization which is 100 years old, you have a thought process, changing that, and along with your customers, thought process changing. Some of the great work that happened in the last 2 years.
So the take-home message, it's not only about hard work, but the sense of belongingness to the institution that you're working with is extremely important. So, Varsha, a question for you. Not because the workforce has been at the workplace, at their own respective workplaces for the last 2 years, they've been in zones for the last 2 years, and because you have been a recruiter of KIIT throughout. So now what are you looking up to? What do you look forward to when you're recruiting our students? I think we have this question, and because they are not asking, so I quickly ask.
So, thank you again, Dr. Bhargava. It's as simple as that. The skill set doesn't change. What we looked at before is the same thing. The interpersonal skills, the way they are motivated to hit the floor, go on running, achieve their dreams, support the organization. It is always the same. What gets added to it is now, if you see what the new problem is, people are upskilling themselves because they have so much of time and opportunity, and the organizations are focusing so much on their self-development of their employees, so that has become part of employee engagement. Because now people are no longer restricted to say, okay, I know this much and I will stop here. No, there is no stop. So it is an ongoing metric which is there in the market right now to say it goes on and on, right? Other than that, what we also look at is how motivated you are, how self-motivated you are. Because we are standing it. We have to make sure that both the leaders said, like, have to push people to go to the office, to do certain kind of amount of, spend certain amount of time in the office or do the normal work that they used to do. Now we should look at somebody who is self-starter, who is self-motivated already, right? Who would stand up for the organization to say, okay, come on, mate, we are ready to take this up. We are ready to support you because the organization has always been ready to support their own people. Right? So nothing changes. It is more about upskilling yourself. It is more about driving your own self rather than always waiting for the push to come from behind. It is about achieving your own so that the organization achieves its own goals so that they can support you directly. Right?
Okay, so when typically you pass out of college and you come into the industry, what I would say that we look at primarily is attitude, like what Sharati said. The attitude of the person who we are taking in needs to be so positive that he or she is open, and the attitude is that is one of that being open. Because during these 2 years, what we really saw, like Varsha rightly said, we needed to request. So, we had conversations with family members, explaining to them why the employee needs to go to a diagnostic lab, set up an RT-PCR machine, why the other guy needs to go help train the clinician there to run the machine, and we will ensure that they are safe. When we say that we will ensure that we are safe, there have been times when a guy is traveling back of beyond somewhere in Jharkhand, and I have been on a call, or my team members has been on a call, video call with the hotel guy to ensure that sanitization of the room is done, food is properly prepared and provided to the employee. So that is the level of last mile focus that we showed as employers. But when we look at new joiners coming in to join the organization, attitude is of first importance because of the fact that it is only when you have that proper positive attitude to be able to step out of your comfort zone will you be able to deliver. There have been cases where we've had manufacturing facility, logistics, shipping, everything needs to happen. So you have two guys sitting in manufacturing who barely can manage an Excel sheet. Okay. But those guys have come, sat back, taken printouts by the kilos, and done what nobody else was supposed to do. At least they weren't supposed to do. They were managed other people and been on the phone. There have been people in senior team leaders in the company who have come in, rosterized, attendance, etc., the work. But they have come in and done stuff which was not their job. So breaking out of your comfort zone and being open to that is critical. So for us, today we look for somebody with an attitude which says, come what may, we'll do it. That's critical to hiring today.
We had a crisis for the last 2 years, but things did not stop. We had 2 years, we could have uplifted ourselves, learned a lot of things, nothing stopped. We had online classes, digitalization was at its boom, so we could explore and exploit all these opportunities.
Yeah, extending to that, what Varsha and Sujata said, let me ask you a question. How many of you want to work from home or work from the site? Who, please raise your hand. Work from home? Only that means you work from home? I think 5-6 people.
I like that.
Yeah, so don't be shy. If you want, that's a new offer. So how many would like to do work from home? So
Please, everyone is raise your hand so that we can see who will to offer today.
Yeah. So good, I think barring 6-7 people or maximum 10, most of them would like to work on site. There is nothing wrong with the work from home or work from site. But one thing you should remember, being a biotech student or a chemical technology student, most of you would be part of an essential service. Healthcare falls under essential service. In my during my 2 years of the COVID, I never had a single day of work from home because we are tagged as essential service. We have to come to office. Barring the documentation team or the marketing team or the support staff or the few other administrative people, everyone had to come to office. Everyone had to come to site because we are manufacturing drugs which were being used by the patients. Okay, and then we are being pressurized by the government or the agencies to manufacture more and more and then do diagnostic tests more and more. So many of you whoever would like to build a career in healthcare, in the manufacturing, or even in R&D, you can't do that work sitting at home. I'm giving a very realistic picture to you so that you orient yourself. And you have to come to office, and that's one probably arena in a healthcare service or in the when you are taking a career in the biotech, you need to keep that in mind. Many of you who would be working in that particular space, you have to keep in mind that you have to work from the side where the activities are happening. So that's very important to keep in mind.
Let me ask the most critical question. Is there? He wants to work from home, I guess.
Why don't you ask for the
Yeah, for me? Okay, go ahead.
Sir, what is the most important for an organization? Listen, core values, or vision?
Sorry, I can get your question. What is the most important?
So, what is the most important thing for your organization? Is it listen, core values, or vision?
Oh, very good question. Is this from Google? You are not supposed to ask me difficult questions. Yes, I will answer that. Thank you so much for that question. You see, an organization is not built of one thing. Right? As I said, organization is purely based on its asset people, and for people to do all these things, right? So all these things go hand in hand. Right? You cannot say, I will follow the values, I will not follow ethical. It doesn't happen like that. Organizations don't run like this. So you have to have all these things put together, and that's what great brands, that's what organization. Right? Does it answer? Let me show you the answers what they do. Okay? Okay. Anything else?
Morning, sir. Simon, I want to say that many of us have heard about that after 10 that like there are only 4 designations or positions in company like engineers, engineering, MBA, or the civil services. Like I have learned that in the pandemic only I have learned that there is a one biotech has evolved very much. So like some of the students, all of the students thinking of that engineering, MBBS, MBA, or the UPSC or civil service, they need things. But I think that biotech is in the line. Like you have seen that in the coronavirus, like most of the all the measures are taken by the biotechnology system. Like we have doctors, but behind the doctors, the backing thing is the biotechnology. So how do you keep that line mindset or that whatever it's like? How do you keep the opportunities? Like there are not like many more industries in biotechnology. How do you take all good measures to grow that biotechnology industries and have most of the students have the opportunity to work in the how do you take or keep the opportunity in the future perspective? What is the future perspective? Basically? It's a general question.
Okay. So I will not say thank you for your question because I think you are extremely confused. Okay. So let me just pick up from what I heard you say. Your basic question is to understand whether or not you have possibilities of a career in biotech. Is that right?
No, what possibilities in biotech, like in biotech is like if you work for it, you will get it. Not that
Anything like that, so only then will it come to you. It's not magic.
no, I'm asking you that what opportunities, what the good leaders will ask that to have that opportunity, like have that for that area.
Okay. So biotech and healthcare is the place to be in today. And each and every area in that space has enough and more opportunity for all of you and more people. Right? Be it sales, be it backend, as in digital marketing, etc., which is a huge space now. And the technical bit, of course, the labs, I think Jeffrey ma'am is the right person to give you full yarn on what all is happening in the industry. So the tech bit she will take over. As far as employment opportunities go, there is so much to do. You just need to be open-minded. And if you, it's unfortunate that many of the kids, I would say 90% of the kids who complete an MTech or an MSc in biotech come forth and say we want only lab jobs. There is a world outside the laboratory also. Lab jobs are great for people who are research oriented and focused. But those who are somewhere have picked up biotech as without knowing what it entails in the lab, I would really request all of you to open your mind. That's what I said. An attitude of openness and an open mind is very important for you to be able to take a career in the space and do more there. Be open. You may become an application scientist. You may become a laboratory research scientist. You may become a great sales guy. So keep those options open for yourself. Did that help?
I have a question for Bhatta. Okay, when you face two equally qualified candidates, how do you determine whom to hire?
Okay, right. Good question. Thank you for that. So qualification is one point. Qualification, I'm sure everybody in the qualification will be fully qualified, right? You will have the same degree. But what would make you stand out of the crowd or have a job in hand is the first thing that ma'am and I we both spoke about. First is the attitude, the right kind of attitude, that is one. Second would be skills. I shout out loud. Skills is something that is going to take you very long way. So that is something that definitely is a very important factor that now I'm going to talk about, and I want to see how many of you raise hands for it. Communication. Very, very important. Communication has to be the key. Until and unless you can articulate what you mean, you can have any number of degrees, you can have any number of qualifications, skill sets, etc. But unless and until you articulate inside your head and be able to present it to the interviewer or anybody who you are talking to or speaking to, it is of no use, dear. I'm honestly speaking my heart out here. Please focus on communication. Communication, both written and verbal, is the key for you to have the differentiation between the qualifications that both of you have in the interview. Unless you are being able to communicate well and express what you mean, it is extremely difficult for the interviewer or any other person to actually, take you for that job, right? So I'm sure these are going to be the key differentiator other than qualification that we're talking about, that both of them need. Thank you.
Very good afternoon to everyone present over here. Myself, Hanshika Mohanty. Belonging to the biotechnology sector, we all know how important, I have always been curious about management sector. And most of us could agree how important it is for an organization. My question would be, I want to know what are the challenges which is faced by the management sector in a healthcare or a life science sector? What are the challenges which are faced by a management sector in a healthcare industry or a life science industry?
Management in healthcare sector, right? What are the challenges?
Yeah.
Look, if you look from an organization perspective, challenges are same. There is no difference between a non-healthcare sector or a healthcare sector. But healthcare sector, typically we have a kind of a vision. So we do some kind of service to the mankind. For example, COVID, if we did not have that passion or if we did not have that kind of drive, we probably would not have been able to develop those kind of vaccines, what we are seeing today. So that one aspect, that one challenge, so there are a lot of external push which is given to the management. And there are a lot of push from the government agencies also, because in the country there may be a lot of diseases which are being uncleared, or there may be set of people who are to be taken care of in terms of their in terms of those kind of diseases. So there are challenges from the government sector, there are challenges from the government agencies, and there are challenges from right from push from common people. Like common people in the sense, certainly one this ailment became very contagious or spread naturally. It's a responsibility for the healthcare sector to, as a service provider, to give some kind of solution. So those are the challenges and how we can give those kind of solutions in an affordable manner. A country like India is very important in the context of the medicines or the treatment what they are giving, how much affordable that is to the common people, which is very important for our country people. So those are the challenges for an organization. At the same time, organization need to look at their own sustainability, their own numbers. So they need to balance the both. So unlike any other sector, these are the additional challenges for healthcare sector that the company probably faces, which we have seen very clearly during the COVID period.
Thank you, sir. Thank you so much. A very good afternoon to all the dignitaries present. This is Vaishnavi. So I have a question to Mr. Jotana. Now, as you rightly mentioned that there are so many jobs out there which are not lab-based. And since we are biotech students, we are more focused on what we have learned. We just know the science. So we don't know what the entire world is offering us, right? So how are we going to be trained? For example, if someone wants to go in sales and marketing, someone wants to go in manufacturing, so we don't know how we are going to, what's the job role is all about. So how are we going to feel that thing?
So it may sound very repetitive, but the fact is keep an open mind. And that is something which will take you places in any and every field that it is in. Unless and until you are adventurous, you will get nowhere. So it's a story of Mandu, do you all know Sanskrit? So a frog in a well, he thinks that's the ocean. Take him out, put him in an ocean, he's lost. So unless and until you want to explore, you will never know what better lies ahead. So thank you. Did I answer your question? Yes, okay. So thanks, but I'm going to say something because I see 70%, and Gopal sir can tell me whether it's 70 or 80 are girls in the course. Right? 80%? What I'm really surprised is no questions coming from you guys I said, okay, I'll come to you later. So no questions to do with what kind of work you girls would want to get into. So should I take this to be a very positive sign that none of you have issues with going on the field, being application scientists, traveling 6 days a week, or being in sales? Because lab jobs are far and few, and I think Jashiman will agree that you really need a research orientation so solid to be able to go and make a place somewhere. Right? So the bulk of the batches will have to go into fields in biotech and professions in biotech which are different than core research. So should I say it like that? Because during the pandemic, please sit down. So during the pandemic, I will speak not only for myself, but a lot of my female HR leaders who have been in closely in touch with in the last few years, that we have ensured and worked towards ensuring that no girl needs to leave her job for family reasons, because play schools are closed, schools haven't opened, small children, they have to be home to look after the babies. When you have a spouse or an extended family support of, say, in-laws, parents looking after the baby, fair enough. But no kid below 12 years of age could be left alone at home when we opened up an essential services, lab services, manufacturing services, where we have a lot of 80% of the manpower in the lab is women. So we have ensured, and I think I take great pride in the fact that no girl has quit work in these 2 years. And those are the things that you guys really need to think about, because that's reality. It's very nice to be in an educational institute, you can do 2 years from home, come to the labs, work 3rd year onwards, and move away with a degree after end of 5 years. But fact of the matter is that unless and until you are geared to handle life, and these are reality bites, the reason why the university is making this immense effort of getting all of us here is to share from our real life. And what you guys really need to ask, and maybe keep on asking us, and we welcome those questions, as to how you can continue your work with all the barriers that can come your way in life. And I'm not talking only about people who are married with kids, a whole bunch of girls, and I'm repeatedly saying kids and girls, so pardon me for that, young adults, whole bunch of you have a very close thought in terms of what you can do. Believe me, push your boundaries and you'll get there. And all of you need to do this on a very active mode. It cannot be socha. It has to be actively done day in and day out. Push yourselves. Push those boundaries that you created for yourselves. And
everybody just a lab job from that time. Okay? I need for about 4 people. Okay? So I can help you there for sure. How many people are really looking for a job? Not professors, please, only students.
Yes.
I actually, since 5 years, I have a very good skill set in that lab. But right now, I am looking for after a job. I see that entry level salary in that lab is not that much competitive as compared to that job. And I know the reason for that, that the reason for relations for example. So I wanted to know what is the weightage of upskilling versus and having core knowledge of your domain that you are looking for. Because right now, if I think about upskilling myself, I have to upskill myself also software, coding language, if I want to have instead of job space. And also another follow-up question I had to that was every year approximately 5% inflation rate is going on. And can you track every level salary in corporate market? Right now it's around 3 lakhs. So how do you want us young job seekers to see that fact or how to progress that fact? Because I've heard from many of my friends who are starting young age that they told me that don't look for a salary in for learn that, how to develop. But I personally, I cannot just completely about the salary. Some salary, but So, if you are looking for a job, look at the job. I'm not saying